Points. Muscles of the neck, the head, neck, and face. There we go. Move this out of the way. So this is, you can actually buy these the quick reference to trigger points. It's trail guide. I don't know where, like some of the textbook websites you can find. It's real little, right? But I only get a digital version. So if anybody wants, I mean, you're going to have the PowerPoint. Just kidding. Okay, so we're going to go over certain trigger points for the muscles of the neck and up, right? So the sternocleidomastoid. This also will help you kind of remember where those muscles are and kind of where they connect, because a lot of times trigger points will be in the muscle belly, and it can also be in the attachment points, because you can get trigger points not only in muscle but fascia, right? Here's the fun part, the possible causes. Are you ready? Some of them are really great, and I'm like, what? So poor posture. I feel like most of the causes for most of the neck muscles are going to be posture related or trauma related. So excessive forward head posture, so people who look down often, which is us, we look down often once we're working, because most of us aren't just closing our eyes, keeping our head perfectly forward. We're going to be looking down at the work, right? Sitting with the head turned for too long on one side. Remember the sternocleidomastoid, or the SCM. That's because that's too long to say constantly. The SCM rotates with the opposite side. So remember that. So turning your head for too long can cause trigger points here. And most of us do that. Most of us are doing that now. And you'll kind of notice, for me, when I watch TV, I'm looking a little to the left a lot. So that's probably why my left side is so jacked up. Not just the TV, but that's because as we progress and do the same patterns every day, that's our new normal, right? All right, protracted neck extension can cause trigger points. Whiplash injuries. So if somebody has a trigger point, this is where the symptoms and indications category will be. Typically, they're going to have soreness in their neck, or they're going to feel like they have that stiff neck. Their head might actually physically be tilted to one side, and they might get a lot of tension headaches. So the big one is people come in because their neck hurts and they slept wrong, or they get a lot of headaches. So we're going to pay a little more attention to the SCM muscle. Remember the technique where I had you kind of pinch it, and all right, you can turn the head around. It's feeling real nice. Pain patterns. So in the picture, you'll notice they have the X's on the actual muscle, which are where the trigger points could be, the most common areas for the trigger points. Then you have a little pink shaded area in the red. Pink is where you might feel the referred pain. Red is where you will feel it more intensely. Does that make sense? So here they might feel it head, cranium, forehead. It might be around the ear or the occiput, so they don't have that. You can't see the back of the head right now. All right. And in some people, they might kind of feel it, the jawline a little bit, a little spot in the chin. All right. So those are where the trigger points they might feel. I noticed a lot of times if somebody has trigger points in the SCM and they're prone to migraines or headaches, when you squeeze that bad boy, you feel it right in here, right above the eyebrow. Somebody help this girl. Next, another image of, this is the deeper head of the SCM. And this slide will also tell you associated trigger points. So that is where other trigger points might pop up when you have an SCM trigger point. So other muscles, right, that might develop trigger points because of this would be the other side SCM, all right, your scalenes, your levator, and your trapezius. So anyhow. When someone has headaches and neck issues, you're going to hit all those muscles anyhow, if you're a good therapist. And then this picture actually shows the around the ear and kind of circular areas right above the brow line. Now, somebody might present with what might seem like a trigger point, and then you're massaging them, and you're like, I don't really feel much of anything going on that seems out of the norm, right? So they might have another diagnosis. Remember, we can't diagnose. So if they're getting regular massage and not seeing a difference with their headaches or pain, have them seek out a medical provider to help with this. It could be a vascular headache, facial neuralgia, trigeminal neuralgia, I can't even say it, Meniere's. So Meniere's disease as well. I just asked Carly because she's the RN.
Do we know what Meniere's is?
I don't remember.
Do you? Yes.
Let's hear it.
It's,
I totally forgot.
I want to say there's like 3 main symptoms, but it's like an inner ear disease. So there is balance problems, ringing in the ears.
Almost like tinnitus meets vertigo.
The vertigo, yeah. The vertigo is the big thing. But all the balance also.
All right.
She's so smart.
She's so smart. She wins. All right. Scalenes. Anterior, middle, and posterior scalene. Remember, there's 3 sections coming in here, right? So, causes: trauma, carrying awkward large objects. This is great.
Like the refrigerator from my basement.
Yes, like the refrigerator from your basement. Whiplash injury. Yeah, I wish that I could be the one that wrote the possible causes. We should have a day like that where we just write possible causes, but make them as crazy as possible.
Well, it didn't specify what kind of trauma. It's like mental trauma, physical trauma.
We're all feeling a little mental trauma. Symptoms that might indicate trigger points: pain in the shoulder or your upper limb. Remember, trigger points often will refer pain down, or there's going to be another picture next that shows us where the pain patterns down the arm would be. All right. Where am I at? Venous obstructions. That's scary. Pain in the upper back. Disturbed sleep or numbness and tingling in the hand. So your pain patterns typically with the scalenes are going to go down the arm. So you could feel it in your lateral shoulder, arm and your forearm, index finger, and the thumb. So a lot of times it's going to affect the radial nerve, not the ulnar nerve. All right. You can feel it in the upper pec region or even the medial border of the scap. So let's see a picture of what I'm saying. Here we go. So you can also still do the arm because it'll feel good, right? But a lot of times people are just so, tight and full of trigger points in the scalenes. You're going to feel it down the arm, radial side. Other associated trigger points would be the other scalenes. Maybe you have a trigger point in the middle scalene. Maybe the posterior is now getting trigger points, or the scalenes on the opposite side of your body. Your SCM. And your splenius capitis, which we are going to go over shortly here, which is a tiny little muscle on the back of your neck. Other diagnosis would be thoracic outlet syndrome or carpal tunnel, articular dysfunction in, C4 through C6 of your vertebrae, or radiculopathy of C5 through 6. All right, so nerve issues can also cause the same patterns or pain patterns here. Another reason why, if someone's getting a lot of massages and they're still getting weird pain patterns down the arm, seek out a medical provider or a neurologist and maybe do a nerve test, right? So they can find which nerve is has the dysfunction, because it could be anywhere from the neck or pinching the shoulder, any joints, all right, could be causing that pain. Splenius capitis. Causes. Postural causes, postural issues. Falling asleep with neck in odd position. Or a motor vehicle accident. See the pattern here? Trauma and posture. Trauma and posture. Indications, pain on the top of the head. Patterns of pain, top of the head. Associated trigger points. The erector muscles along the spine and the semispinalis thoracis along the spine. So these are all going to be your erector type muscles that can start dysfunctioning. Is that a word? Sounds good to me. Start having dysfunction. All right, other diagnosis would be articular dysfunction in C2. C2 is really high up. All right. Occipital-atlantal, I can't say it, occipital-atlantal dysfunction, or whiplash syndrome. Are you ready for more? All right, so we had our capitis. This is the cervicis. Remember the difference. The capitis, cap, is going to be referring to head. Cervicis means the attachment points are actually just all on the cervical spine. Okay, so I'll let you see a picture here. See how it actually attaches to the head at the occipital region for capitis? Cervicis does not. It's just kind of connecting onto your transverse process. So the splenius cervicis, postural stress, sleeping with the neck in an odd position, motor vehicle accident, excessive rotation or extension of the head, postural problems. Symptoms, pain in the neck, around the eye or the head, or they might feel like a stiff neck coming on. The patterns of pain would be around the lateral part of your eyebrows. It can radiate to the temples, right? And into the posterior or the back of the neck. Other trigger points associated would be erectors and the semispinalis thoracis. Again, all those erectors down your back. Because this is kind of a neck erector, right? All right, other diagnoses. I don't even know if that's in your books, but it's good to know. Same as the splenius capitis. Articular dysfunction, C2, occipital-atlantal dysfunction, and whiplash. Boom. Has anybody had whiplash before in this room? That's good. Me neither. Maybe at Cedar Point when I was 6. Man. Does anybody like roller coasters in this room? Y'all crazy. Never again. That's traumatizing.
I like
Blue
the,
Street.
I was gonna say, I love the little ones at Kennywood, but don't put me on any of those big.
What about the Gemini, the rickety, is that one still there?
The wooden one?
The wooden one? The Gemini?
Cedar at Kennywood is the blue.
That'll mess you up.
Where at?
Cedar Point.
I've been there once. I wanted to go on the one that goes like this, all the way straight up, and it drops straight down. I like all
Nah, bro. No. I'm good. I like my feet being on the ground. It's cool. All right, where am I at?
They took a log jammer out of Kennywood, Belmont College.
Yes, I am. All right, the semispinalis capitis. More of the capitis. Capitis. Causes hitting your noggin. It doesn't say that. Motor vehicle accident. Acute overload. Postural stress. I love that they just keep rewording the same thing. It's great. Indications are headaches, tenderness over the back of the head and the neck, right? numbness or tingling or burning in the scalp. Remember this one. This creates a headband pain pattern. Headband. Might be on a quiz somewhere.
It's not in our book?
No, it's not. It's my spinalis capitis is
I'm
not
just
in our book.
adding stuff. It might be under all the capituses. I don't know. That's why I said that book is just for your reference. I pulled this information from Trail Guide because Trail Guide is the goat.
You said the headband?
Headband.
See, and that's not what I think about a headband. I think of a headband that goes ear to ear.
No, like you're about to go work out. Sweatband. Sweat. Semi-sweat. Wet. Got going like a turbo vet. Okay, just kidding. All right. Differential diagnosis. Yeah. Fibro might cause pain here. Facet joint osteoarthritis. So that's arthritis in the facet joints of your vertebrae. That would suck. That would hurt.
Hold on, don't change page yet.
Tell me when I may.
Oh, I don't have a pen.
Do you need a pen?
I think I got one. I have 3. Surely one of them right.
I stole a bunch of pens from the billing office this morning.
I might need one.
They're out there. They're Belmont pens. That's where everybody tells me to take them from. When I ask staff, where do you get your pens? Billing.
What?
We hate financial aid.
Do they have a bunch in financial aid too?
No, I just hate them.
Steal their pens.
Okay, I'm good, thank you. I got you.
The school buys them anyhow.
They have Sharpies, I'll steal them.
Steal the Sharpies. No, don't steal the Sharpies. Those aren't funded by the school. Next. Temporalis. Ooh. The next few slides are going to be the muscles of mastication. Do you guys remember the muscles of mastication? I'm so excited to ask that question.
Masseter,
One.
pterygoids, lateral pterygoids, medial pterygoids.
One more.
Hey, I'm glad I got the ones that weren't on the screen. Thank you much.
You're like, I'm lost. Not points. And yes, we got it. Cool. A+. Temporalis causes for trigger points. Grinding or clenching your teeth. Direct trauma such as a fall or forward head posture. Symptoms and indications would be head pain or sometimes a toothache. It might not be your tooth at all. Pain patterns, upper row of teeth. All right. Temporal region, that one makes sense. Over the eyebrow. Remember this muscle, we like to hit the temporalis muscle, not literally hit it, but massage it when someone has headaches. So if someone has headaches, not only are we giving them an awesome scalp massage, we are going to do the neck and shoulders, that makes sense, but also all of the mastication muscles. Because maybe when this is tight, this makes sense, right? Everything in the jaw and the temporalis is tight. It might just work its way down the neck. Or maybe, the neck caused the problems up here. Remember the pain pattern that is like a question mark? That's what we're talking about. Not the pain pattern, but dysfunction along that chain. Associated trigger points, masseter, temporalis on the other side, and the pterygoid muscles. That's shocking that they all go together, right? Other diagnoses, TMJ joint disorder. So maybe it's just not a trigger point and they actually have a disorder in the TMJ. Or diseased teeth. It could be actually a periodontal issue, tension type headaches, or temporal tinnitus, or tendinitis, sorry. Not tinnitus. Although, hey, maybe they will get tinnitus if things are tight. Masseter. This looks so scary. Doesn't it just look like this is all stapled clothes, like some scary Halloween mask? Terrifying. The masseter. Possible causes. A sudden forceful contraction. Repetitive jaw habits. Y'all better stop your repetitive jaw habits right now. Chronic mouth breathing and psychological stress. Well, if you're mouth breathing, your mouth is constantly, right, depressed. And maybe you are depressed too, psychological stress. A lot of people tend to clench and grind when they're stressed out. Indications or symptoms, TMJ joint symptoms. Tension in the masseter and temporalis. Or maybe there's a restriction with opening the jaw or chewing. You'll get that click, 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 and that is a big indication for a TMJ dysfunction. Here it is, I knew it. Unilateral tinnitus. Sometimes it is muscular when people are hearing the ringing in the ear. Pain patterns. You're going to feel in the molars. The molars. So your molars, your TMJ, mandibular and eyebrow area. So mandible, all right, eyebrow. That's what we're talking about. Here's another picture of the masseter pain patterns. Here we're showing the jaw, some parts in the mandible, and then the rest of it. Ear. Sometimes people are thinking they're having earaches. Maybe they are having an earache, all right? And they're going to feel it there. Associated trigger points, you might also have temporalis, medial pterygoid, and SCM trigger points. Other diagnoses would be tinnitus, pulpitis, inflammation of the periodontal ligaments in your teeth, tension type headaches, earaches, toothaches. So you want to rule out that they aren't having dental issues, especially if you're working around the mouth, because that's gotta hurt, I imagine. Okay. Medial pterygoid. Possible causes for trigger points. Forward head posture. Trigger points in the lateral pterygoid. Excessive gum chewing. Watch your gum chewing, guys. Grinding and clenching your teeth and anxiety. Is anyone an excessive gum chewer in this class? Yay! I used to be. What is your gum of choice?
I think you actually have these little squares and some cubes now.
That's what I'm extra.
They're kind of soft.
When I was a teenager and in my early 20s, extra polar ice. Always had extra polar ice.
That was nice. Is that the hard shell stuff?
No, it's just sticks, and it's real minty.
Carefree gum back in the 80s.
Carefree that lost its flavor in 5 minutes. Or the zebra gum that was so good for 5 minutes.
So now you gotta get your gum back out. It was fine.
That looks like grape.
Remember Chewels?
You want
No. Is it grape?
grape puffs?
They had the juice in the middle.
Oh,
They
yeah.
were big fat ones. No, they're too young.
Anybody who's working on Jamie better bust out their mad masseter skills today. Okay, indications or symptoms. Increased pain when opening your mouth wide or chewing food. Clenching your teeth. Soreness inside the throat. Or painful swallowing. Pain patterns, again, it's going to refer pain right into that temporal mandibular joint here. All right, and the side of the jaw. You're going to feel all through here. They might also have trigger points. I don't know why this is in this section, but trigger points in all the other mastication muscles and the SCM. That's why it's important to work them all. This is why we're trying to understand how everything works together. And sometimes you have to try different things because what you tried in the last session didn't work or made them worse. It's okay if it makes them worse because you know that that's probably not the issue, or maybe it is the issue. Now it's super inflamed. So that's why we're constantly changing what we're doing and constantly reassessing our clients, even though it's somebody maybe we see weekly. They might not get the same exact session every week. So you need to be versatile and not just have your same routine, like you're just like a workhorse doing the same thing over and over and over again. Lateral pterygoid causes trigger points in your SCM. Mechanical stress caused by poor posture. There's your posture. Excessive grinding, your repetition. Are you ready? Playing a wind instrument.
Yeah.
Bada bing, bada boom. So, if somebody is in an orchestra
Orchestra, the marching band.
or band of some sort, and they're having issues in the TMJ region, maybe they have a trigger point in their lateral pterygoid. Right? And you want to work it out so that they can continue to play their wind instrument seamlessly without pain. No, for real though. Symptoms and indications. Severe pain in the temporomandibular joint region. You might have shortening of your muscles. You might have tinnitus, ringing in the ear, and pain when chewing. Pain patterns would be your TMJ or you know what I'm saying. Your TMJ or the front of your face. You're going to feel it more maxilla region, right? Differential diagnosis would be trigger points elsewhere, like the medial pterygoid or trigeminal neuralgia. All right, the other ones I have, are you ready? Bonus! You're welcome.
None of us read the name textbook.
Not in textbook. Occipitofrontalis. Remember the Gallia aponeurotica? The sheath that connects your occipital and your frontalis muscle. So that is called the Gallia aponeurotica. I just feel fancy because I like the word, so I remembered it. All right, possible causes. So we're linking this into one muscle right now and not dividing the two. Possible causes for trigger points would be, we're talking frontalis first, SCM trigger points and stress. Now remember, your frontalis muscle is primarily used to raise your eyebrows. So if you're stressed out a lot doing some eyebrow stuff, that sounds weird. It's going to cause tension on the connective tissue, the fascia, right? And pull on your occipitals. Same thing. If you're going to have issues with the occipitals in the back, you're going to have tension being pulled this way, causing maybe headaches or something. So, chronically raised eyebrows, because you're really shocked. So the occipitalis causes could be decreased visual acuity. Maybe you're having vision issues, right? So you're, doing this and causing pull, right? Postural cervical muscles, trigger points in the cervical posterior muscles. Indications: intolerance to pressure on back of head. Some people are super hypersensitive. You know the awesome move where you shove your fingertips into the occiput? Some people are not about it and they can't handle it at all, right? I think they're babies. No, I'm just kidding. They might actually have a lot of tension in the occipitofrontalis muscles. So pain patterns, frontalis directly over the muscle, all right, forehead, right, maybe it's on one side, right. Occipitalis would be the parietal region of the scalp, right, and the upper eyelid. They might also have tension headaches that have nothing to do with this, or trigger points in the SCM, or neighboring trigger points in the back of the skull, or occipital neuralgia. Ooh, mouthful. But this is also, I think, a really important muscle to target when people have a lot of headaches. Plus, it feels nice. And then, any of you with longer hair ever feel like after you've had your hair up a while, it's really tender up in here? Well, that's just all the pressure. And if your ponytail is heavy, what it's doing is applying pressure here, right? So it's applying pressure to the frontalis and causing, probably, my guess is a hypersensitivity to the top of the head.
It was just so good to take the honey out.
It does. It feels so nice. Did I do that all? Yeah. Suboccipitals. Trigger points. This is a big headache muscle too. Trigger points could be caused by forward head posture or sustained forward flexion of the head. I feel like that's the same exact thing. All right, so flexion of the head. Symptoms and indications would be your headache or deep-seated pain in your upper neck, or difficulty rotating your head. Pain patterns. The temporal region, occipital region. So it's going to be all through here. The headache muscles. Or they might have tension headaches that, have nothing to do with this specific muscle, right? Cervicogenic headaches. So that would be like almost, what's the word? What is the word for that? I can't think of it. The headaches that are in random spots. Cluster headaches. Cluster headaches, occipital neuralgia. Thank you. Articular dysfunctions in your upper cervicals. Boom, baby. Now, this one's not that important, but it's fun. It's a bonus. It's the last bonus. Your digastric. Right, so we're talking about that tiny little muscle underneath your jaw, right? Is this the mu muscle? Are you guys doing it? Are you guys doing it? Do you know what I'm talking about?
No.
The mu muscle? It's this thing that people do on the internet where they take the bottom of your tongue and put it on the top of your mouth to kind of raise this up, right? And then also give you more pronounced cheeks. I don't know. Do you know what I'm talking about?
You're supposed to suck it to the roof of your mouth and move it, and it'll
Do it! Do it!
It's just pulling up.
Anyhow,
Carrie's also the
we're gonna find a video after this,
Where's the Gen Z kids? They know.
right? You failed us, Kiki. Digastric, sorry. Retrusion of the mandible. Mouth breathing, these are causes. Excessive grinding of the teeth. I love the mouth breathing.
Yeah, what the hell is retrusion?
The opposite of protrusion.
So, retract?
Yeah.
So we just made up a new fucking word?
Yes, Trail Guide made up a new word. Actually, probably is a word. I don't know. But yeah, protract. Retract, sorry. Where am I? You guys got me all discombobulated. I'm like the opposite of protrusion.
And I'm like, what the fuck is retrusion?
I'm going to look it up. I mean, we know what it is, but
Currently looking
I
at
want to see what the internet.
It means the backward
Retraction.
movement or displacement of a body part, most commonly used in dentistry and anatomy to describe the lower jaw. So yeah, retraction.
It's retraction.
AKA retrusion.
Come on. Synonym. All right, symptoms and indications. Difficulty swallowing. Sensations of a lump in your throat. If you have a lump in your throat, you feel like you should go to the doctor. Difficulty turning your head. Because you're going to have pain patterns in the lower teeth or the upper lateral neck below your ear. Or you can have a masseter or temporalis trigger point. Or trigger points in neighboring muscles. Okay, I'm going to stop this, but I'm going to show you guys what mewing is for fun.
Are you saying mewing?
It's called Mew, right?
Mew.
Mew? Like a kitten? Mew. Good day.